Safety briefing, take one.
100. So this briefing is about taking you through the first aid guidance that's been disseminated to you all. It was sent out by email by Stephen Bailey to I think all the parents as well, so you should all have a copy of it. I've highlighted some sections that I think are important, and I'm just going to talk you through those items, and I can send it out to all of you after the briefing, so you've got what my notes are. First of all, this is to follow the government guidance, and what they're saying here in the first part of the paragraph is that COVID-19 is transmitted through cough droplets. I think you probably all know that, but I'm just restating that. Then it's talking about personal hygiene. We need to hand wash, we need to use hand sanitizers on a regular basis. And then we also need to make sure that the environment is hygienic, so goals and balls need to be disinfected on a regular basis, meaning before each session, and sometimes people actually say, well, we need to do it after as well. Then there's the social distancing. Social distancing, it states that all coaches should bring their face masks to training. And that is really as an extra precaution, because it's proven that if you're wearing this all the time, then you'll be fine. So that's just what it says here. It doesn't just dictate you have to wear it, but it just says it's recommended. Then it moves on to a self-checks before each session. There is a sort of questionnaire that each player should be asking themselves before they come to the session. We suggest that the session leader should actually ask each player when they arrive whether they've done their self-assessment, and whether, in particular, because we had an incident a couple of weeks ago where a player collapsed very soon into the session. So just a simple question: are you feeling well? Is everybody in your family feeling well? I think would suffice at least to mitigate any risk happening throughout the session. Then it talks about what do you do if somebody develops symptoms consistent with COVID-19 during a session. First of all, you need to segregate them from the rest of the group, and then you need to call their members of family and then get them off site as soon as possible. Then there is the additional thing that we need to advise our parents that we've had a COVID symptom incident, and then obviously we need to follow up on whether it's actually materialized or not. And if it has, then we need to put in the track and trace for NHS. So then it moves on to the first aid. It says that everybody should have a first aid medical kits. We all have that, and we should check them before each session. And that's nothing related really to COVID. It's something that we should be doing anyway. And then there's first aid qualifications. The club are moving towards making sure that everybody has first aid response qualification and taking that course. So if you don't have it in date, you should seek to actually get it in date. If you don't have it in the first place, you should seek to actually get it. Then it moves on to about first aid in the football practice in a COVID-19 environment. And I've highlighted one specific paragraph because that paragraph is reiterated twice in this leaflet here. And it states, and I'm going to read it out: the safety of the responder is paramount, and no one is expected to provide care which jeopardizes their own personal health or safety. In an emergency situation where suitable PPE is not available, the responder must consider the potential risk to both themselves and the player and decide what level of care they feel is reasonable, or what level of care they are able to provide in the absence of PPE. This may include providing no assistance at all until the ambulance arrives or until appropriate PPE is made available. So it means if you don't have the PPE, you don't need to take any action at all, if you don't want to. Then it moves on to different levels of PPE equipment that you should be using for various scenarios. They're talking about level 1, level 2 and level 3. Level 1, and I'll go through in specific scenarios what that actually means and how you should be using it. In a non-medical scenario, you can just use this. If you get into a situation where you need to provide first aid in a sudden cardiac arrest, this is the most difficult one. It is anticipated that a sudden cardiac arrest will be aerosol generating procedure. Aerosol generating procedure is where you can expect fluid or droplets to actually come out of your mouth and nose. And there is a higher risk of COVID-19 transmission, so you need to be extra careful in those kind of scenarios. If it is an adult, given that we are all first aiders and we could see a member of the public or one of the parents falling ill, then the advice is not to give resuscitation breaths, but just CPR. Right. And the PPE that you are supposed to wear is gloves, apron, fluid-resistant face mask, so this one is no longer good enough, and goggles. You also need to put, and it says here, a cloth or something over the patient's mouth so it doesn't spew out aerosol droplets. If it is a child, it is recommended to do resuscitation breaths, and so in those kind of scenarios you have to put one of those face shields on. And it says here also, providing rescue breaths will increase the risk of transmitting COVID-19 virus either to the rescuer or the player. However, this risk is small compared to the risk of taking no action, as it will result in certain cardiac arrest and death of the child. Alright? So it also goes on and says, so that's really the ultimate scenario, and in those kind of scenarios you need to have the full level 3 PPE clothing on. That meaning a long sleeved gown, it means face mask, and well, you can't use the face mask, but you can use the face piece, and then you have to have the goggles and the gloves.
So am I right in saying that there's a device that we're going to distribute as well, which prevents the breath coming back into you while you're delivering the CPR? Mm-hmm. So, and all of the kit Martin's talking about, there is at least one set of it in every location.
Let me just look at it.
So basically the girls will have the stuff that's in there as well as the boys. They just share it, and if it needs replacing, then we replace it.
It gets used, it gets replaced, it's as simple as that, So
it will be in bags like this, and you can see there's the goggles, there's the face masks, and there's the gowns as well.
Really, when we're doing CPR, they tell you to use at least 2 or 3 people doing it.
Yeah.
But if we've only got one kit,
That's a good point.
That's an excellent point.
Very good point. Inge.
So
Yeah,
we'll make
we
sure
need-
that we have at least 2 kits.
Yeah, it's got to be at least 2.
Yeah.
If we can lay our hands, I think if we can lay our hands on it, we should have 3 in each location because the medical recommendation is 3 people
around and
because you
change
get
over,
tired.
give people a rest,
Yeah.
haven't you?
Yeah,
Yeah.
yeah,
Very good point.
great point.
That's why I bought him, boys.
Is he the brains? Is he the brains of that thing, right? Yeah.
So, other potential injuries that occur during football training. So again, the first duty of the carer is to yourself, and it's imperative you take precautions for yourself. And in the vast majority of incidents, you can actually stand back and direct. So if you have parents, which I recommend you have parents on site, you can get the parents to do it and you can direct the parents in a safe distance. If you have to see them, the FA has taken the position of putting safety first, and they say that you have to use disposable gloves, apron, fluid resistant surgical masks as a minimum. If there's loss of consciousness, again, it says you need to have PPE, gloves, apron, fluid resistant face mask and goggles. If there's a compromised airway, it's the same. So pretty much, if it's anything that you need to do, you need to put the PPE on if you need to attend to a child. If there's a bleeding wound present, so being it nasal or oral wounds, so that is an aerosol generating incident, and you need to make sure that you are more than 2 meters away, and you need to move the players away from everybody else, or move everybody else away from those. And then you can still direct. If you need to get involved in it, then you need to get the full gown, the goggles, the face mask, and gloves. Other wounds that it doesn't involve oral or nasal incidents, it is sufficient to use the gloves, apron, fluid-resistant mask as well. So other wounds, it's similar to pretty much any other incident, but if it's something to do with a nosebleed or somebody spitting blood and things like that, move everybody away at least 2 meters. Ideally a lot more. If there has been a blood spill or blood fluid spill, or body fluid spill, we need to cover it, use Verisol, and then clear it up in a most hygienic way we can think of. That was the right word. and then it goes on and it says here, to reiterate, the safety of the responder is paramount, and it's the same statement as I actually said earlier. Which means that you may not provide any assistance to the player until you have appropriate PPE in place. It then goes on to various algorithms of what to do in different situations, but essentially it just covers what I've just been speaking about. What PPE you need to use in various scenarios. And that's about it from a first aid license perspective and PPE. Now then there are some risks that we've done a risk assessment for all the sites that are currently operating. Some of them are very much age group and club related, but then there is also some that are coaches related, and I'm just going to reiterate the coaches ones. So to maintain social distancing and avoid congestion, we need to avoid congestions in that changing room area. And if we are to go in, we actually need to, the guidance says we need to put one of those masks on, one of those fluid resistant masks. So to mitigate that, we've suggested that only one person goes in there at the time. Avoid parents getting too close to the training session. Set up the respect barrier for parents to stay social distance from the session, and we need to do that at arrival. Avoid players getting too close while getting their drink. Use cones to socialize the distance each player's drink, hand sanitizer, etc. Avoid vortexes mixing, only one vortex having drinks at the time. Rotating the vortexes between sessions must be done in the same direction, which we've been doing already, certainly as the under 11s. Avoid touching the ball. Should anybody touch the ball must be disinfected. That's not just the players, it's the coaches, it's members of the public. If anybody touches it, disinfect it.
With their hands, obviously. Yeah. But any part of their skin, I would say I'd do it. It's their arm, whatever. But obviously not their feet.
Yes, they got gloves.
Sorry?
Yes, they got gloves.
They're allowed to play in goal with gloves on.
Yeah. So that shooting drill we do, that's parents collecting the ball. Okay, if they're kicking it,
they can kick
if they're handling it, disinfecting.
Correct.
Cool.
One thing I would look to do, while we're on this subject of goalkeepers, personally, next week I wouldn't do it. I wouldn't have goalkeepers. Personally, we won't be having goalkeepers. There'll be an area around the goal that's covered. You're not allowed to get an area you're not allowed to shoot. Okay?
It's not a bad shout, because in contact football, the ball can get smashed straight in their face, can't they?
It can be done, but I personally would rather take it away.
I'll have a think about that. There is a bit of me that says, goalkeeper stood there, Oliver Stone goes through on goal, absolutely wellies it straight in the face. It's potentially a risk just not worth taking, isn't it? I know that can happen in open play as well, but it's far more likely with a keeper.
There's ways and means we can do it.
Where it's still football, it's still...
easily.
Let's have a think about that.
Okay, so just for the purpose of the video, there's been some discussion about what to do with goalkeepers, and we are reconsidering our approach on that one. And then finally, attending to player injuries should be carried out by the parents unless there is a threat to life. And then, is the first aid kit complete and present at each session? We need to ensure that our first kits are complete. So if you haven't done it recently, please do it and get it replenished if need be. And it needs to be done before each session.
If you brought them today, I'll have a look through them and check everything's in there. You're typically missing things like the sanitising wipes and the ice packs, they're the ones that go.
And that's it. Any questions, comments?
Real good?
All right with that?
Good, cheers.
Yeah.
Good. Well done, Martin. Thanks, Martin.
Yeah, nice one.
One thing, the cardiac arrest, with the PPE, is that advisable or necessary?
It says here.
Because I'm just thinking, if
The whole thing's advisory. If a kid goes down, there's
you
no way
get
you're
through
going to let
straight
that
away.
kid
You
die.
don't just stand there thinking, I'll get dressed first while he's dying.
It's obviously up to the coach and the specific situation. The FA aren't going to ban you from touching them, are they? But what they are saying is, if there's time for you to get the PPE kit on for that particular situation, you should do to protect yourself.
What's the sound like on the
What it says here?
Three coaches standing there getting dressed.
What it says here specifically, it says the coach or potential the coach or potential helper must consider the potential risk for both themselves and the player to decide what level of care they feel is reasonable or what level of care they are able to provide in the absence of PPE. So it's entirely up to you what level of care you want to do.
It's very carefully worded, exactly as you're saying, isn't it? Yeah.
I don't want three coaches thinking they're not allowed to touch him unless they've got dressed first in PPE kit.
It's very clear that you as a coach need to decide what level of care you want to provide in the absence of PPE.
It's going to be normal care.
Of course, the first thing that should happen is that the parent administers CPR under your direction. Right?
Again,
you can tell somebody how to do it, I think, if you know how to do it, you can direct somebody how to do it, and then you can put your gown
I
on.
mean, we've all been on 3-hour courses to find out how to do it, to get a parent to do it who's never done it before in 30 seconds.
I think it depends on the situation again, doesn't it? You know,
I
unless
think you would literally, in the situation,
Everything else goes out the window.
of course you would. You just do it.
But then if it's a sprained ankle,
Oh yeah,
that's
yeah,
just
and that, yeah. I'm not
different
talking about
kettle of
little
fish.
things like
Yeah.
that.
it's life and limb.
Yeah.
React to it.
It was this bit that I was concerned we absolutely nailed, right? Because the chances of it happening are minuscule, but if it were to, we all need to know what we're doing, right? So I do think it's a great point about getting 3 of them on each site.
I'll
think
take
that's
that as a
important.
note point. And,
Okay.
Thank you,
Right.
Martin.
Shall I cease recording?
I think so.